Hi, my name is Mehreen and I'm a psychologist, and I'm here to address the elephant in the room. Some of you may be aware of its presence and some not. I'm talking about the mental health crisis that is being triggered by COVID-19. Some experts are going so far as to say that we may just have a pandemic within a pandemic if this mental health crisis is not addressed. Why is the COVID-19 creating this mental health crisis? Well, it all starts with the necessary preventive measures that governments are having to take, and that is social distancing, quarantining, curfews. We are all creatures of habit, and suddenly and abruptly our routines have been disrupted. Our work and leisure outside of home has been restricted. We are segregated from our loved ones. We are feeling alone. Since generations, we have been taught that human beings are social animals, that there's goodness in togetherness, that there's strength in unity, and social distancing and isolation has always been associated with punishment. Let's take the example of jail time, and to make it worse, solitary confinement while you're in jail. When we're kids, if you're out of line, we are grounded. When we're toddlers, we are given a time out, or we are asked to go and stand in a corner. These are all examples of socially isolating people in order to punish them. Generations of social conditioning and learning suddenly now seems meaningless to human beings because we have to socially isolate ourselves in order to survive. Standing alone is now considered strength. These are necessary precautions, but these are extreme measures. Let's take a second to be mindful about the magnanimity of the situation. These are not at all ordinary circumstances. But change does not mean that it has to be negative. Change is not bad. Change just means that we need to put in more effort. There may be a struggle, but struggle does not mean failure. Some of us may be struggling more than others, but there are many who are struggling. And luckily, mental health experts across the globe are researching and working to come up with new strategies to help people cope with these drastic changes. So in my upcoming talks, I'm going to be talking about the prevalent mental health problems that people are mostly facing these days. We will be talking about different coping mechanisms that we can practice at home to help ourselves or to help those around us. But after all is said and done, if you feel that you need help more than others, going to a mental health expert is always the best route. Hoping that I can help all of you and that we can help each other in this time of crisis. Stay tuned.